Grace, and today I'm going to be doing a medication administration checkoff. So my evaluator is Sarah, and my videographer is also Sarah. And so today I have a provider's order for patient Jamie Wheeler. Today I'm going to give 3 medications. One will be an oral medication and 2 will be injections. I have an order for erythromycin, 250 milligrams by mouth, and varicella, 0.5 milliliters subcutaneously, and dexamethasone, 4 milligrams intramuscularly. So I have Jamie Wheeler, 10/31/1947, and I'm going to go ahead and confirm that with my MAR. Jamie Wheeler, 10/31/1947. I have erythromycin, 250 milligrams orally at 8 a.m., varicella vaccine 0.5 milliliters subcutaneously at 8 a.m., and dexamethasone 4 milligrams intramuscularly at 8 a.m. And so I've verified this all, and so I'm going to go ahead and introduce myself to my patient and just kind of explain what we're doing today. Okay, hi Mr. Wheeler, my name is Grace, and I'm going to be your student nurse today. So today I'm just going to ask you if you can go ahead and verify your name and date of birth. So my patient has verified that he is indeed Jamie Wheeler and he has the right date of birth. So today I have a provider's order to give you 3 medications. I have 1 oral medication, erythromycin, and 2 injections, varicella and dexamethasone. And so today I need to ask you if you have any allergies. And so the patient has told me that he does have an allergy to codeine. And so basically, at this point, I'd be doing vital signs and any labs or any assessments that I would need to do to see if I need to hold any of these medications. And so for erythromycin, I'd just look for, I'd assess for infection and bowel function. So he does have an infection, so we'd go ahead and give this medication. For dexamethasone, I would assess signs of insufficiency. I'd monitor his eyes and nose and his breath sounds. And so he does have inflammation and stuff, so we will be giving this medication. And then for varicella, I just assess the patient's need for this vaccine. And so, Mr. Wheeler, so I'm going to go ahead and go draw up these medications, but when I come back, I will explain to you what these medications are, just kind of why I'm giving them to you, and some of the side effects you might have. Okay, so I'm going to go ahead and I'm going to grab my medications. So I'm going to take my medical record with me, and I can see that I need to get erythromycin, 250 milligrams by mouth. And so I see that we have erythromycin, 250 milligrams, and this is within the expiration date to give, and I'll be giving this at 8 a.m. I have the varicella vaccine. This is varicella virus vaccine, 0.5 milliliters. This will be subcutaneously, and it is within the expiration date to give, and I'll be giving this at 8 a.m. And then I have dexamethasone, which is within the expiration date to give as well. This is an intramuscular injection. I have 4 milligrams, which will be 1 milliliter, and I will also be giving this at 8 a.m. So I'm going to go ahead and verify this with my provider's order. So I will have erythromycin, 250 milligrams by mouth. I have the varicella vaccine, 0.5 milliliters subcutaneously, and then dexamethasone, 4 milligrams intramuscularly. And then it is Jamie Wheeler, 10/31/1947, and Jamie Wheeler, 10/31/1947. So I'm going to go ahead and gather some of my supplies. So for the varicella vaccine, I'll use a 1 milliliter syringe with a 25 gauge needle, 5/8 inches. And then for dexamethasone, I will be using a 3 milliliter with a 21 gauge and 1 inch needle, but I will be changing this needle, so I will change it to a 25 gauge 5/8 inch needle. So before I leave, I will once again verify that I do have all of my medications and it is right. And so I see that is erythromycin, 250 milligrams orally, varicella, 0.5 milliliters subcutaneously, and then dexamethasone, 4 milligrams intramuscularly, and I will check this with my provider's order. And those are all correct, and then it is also Jamie Wheeler, 10/31/1947. Jamie Wheeler, 10/31/1947. So we'll grab medication cup. Alright, so I will go set all of these out. So dexamethasone, varicella, Alright, I'm gonna go get gloves. Alright, so first I'm going to do the dexamethasone, and so I'm going to go ahead and get my syringe ready. And my needle ready. Okay, so I'm going to first make sure that this is on securely. I'm then going to alcohol swab the top of my medication just to make it ready to penetrate with the first needle. I'll do this for 15 seconds. Alright. Okay, so I'm going to be giving 4 milligrams, which is 1 milliliter, so I will pull up 1 milliliter, maybe a little bit extra of air. I will be injecting this air into my vial, just to help with any of the air bubbles we might get. So I'm going to go ahead and eject 1 milliliter of medication, and maybe a little bit more just to get rid of some of these air bubbles. And I'm going to go ahead and flick my syringe, make sure that I don't have any air bubbles present. It doesn't look like we have any. So I will be removing this and recapping it. Alright, and then I'm going to go ahead and remove this needle and put the correct 25 gauge needle on. I'm going to go ahead and put this in the sharps container. Alright, and now I'm going to get my varicella virus vaccine prepared. And so I'll be giving 0.5 milliliters of this. So I will go ahead and pull out 0.5, maybe a little bit extra, and then I will go ahead and do this for 15 seconds. Alright, so now I'm going to go ahead and put the air back into this vial. Okay, and now I will pull out 0.5, maybe just a little bit extra, just to help with any of those air bubbles we might get. And I'll go ahead and flick the syringe and make sure I don't have any air bubbles. It doesn't appear that I do, so I will be taking this out and recapping this. Alright. Okay, so now these medications are ready. Okay, so I am going to go ahead and give my oral medication, but before I do this, I'm going to go ahead and check and make sure that this is the right patient. Jamie Wheeler, I do have the right patient. I will be giving this at 8 a.m. It is erythromycin. Alright, it is 250 milligrams, and I will be giving this orally. Alright, now I'm going to go ahead and I will be educating my patient on why they're taking this medication and how it is going to help them any side effects that they might see. Okay, Mr. Wheeler, so today I will be giving you your oral medication, which is erythromycin. And so the reason we're giving you this is because it seems that you have a bacterial infection. The only reason I would not give you this medication is if you didn't have any signs of a bacterial infection. And some of the common side effects that you might see with this are vomiting. And so after I give you this medication and the other medications, you will be under evaluation and just we'll be able to help you out with any of those side effects that you might have. So I'm going to go ahead and I'm just going to sit him up a little bit higher just to help him swallow this medication. And so I'm going to come over here. And first I'm going to ask you if you have any allergies once again. Okay, so he has told me that he has an allergy to codeine, and this is not codeine, but I'm going to reassess this with our MAR, and it is, he does have a codeine allergy. So I'm going to go ahead and give this medication. Okay, and give him some water to take this. All right, and so at this point I would see that and confirm that my patient has taken his oral medication. And I would document this, that it was at 8 a.m. and I would initial next to it. Okay, so now I'm going to go ahead and I will give my dexamethasone 4 milligrams. So I'm going to go ahead and verify that this is dexamethasone 4 milligrams, which is 1 milliliter. I have 1 milliliter drawn. And then this will be an intramuscular injection, and since it is 1 milliliter, I will be giving it in the deltoid. And then this is Jamie Wheeler, 10/31/1947. Jamie Wheeler, 10/31/1947, dexamethasone 4 milligrams intramuscularly, and I will be giving this at 8 a.m. So now I'm going to go ahead and teach my patient just kind of why we're giving them this medication. Okay, Mr. Wheeler, so today I'm going to give you your first injection. It'll be an intramuscular injection, so it'll be in your right upper arm, also your deltoid. So basically, I will be giving you dexamethasone. So this is going to help with some of the inflammation you've been having with your rheumatoid arthritis, and kind of just help bring back that normal immune response. So the reason I would not give this medication would be if you had no signs of inflammation, but since you do, I will go ahead and be giving you this medication. Some of the side effects that you might see with this medication are muscle wasting, osteoporosis, depression, hypertension, and decreased wound healing, and you will be under evaluation, just like I said before, just to see if you do have any of these medications. So I'm going to ask you once more if you have any allergies. Okay, he has told me that he has an allergy to codeine, and I have made sure that this is not codeine. So we are okay to give this medication. So I'm going to go ahead and I'm going to take down my safety, and I'm going to go prepare my administration site. I will be giving this in the deltoid, and I will find this by finding the endophysichromium process and putting approximately 2 fingers below this, and this will be our injection site. I will go ahead and prep this for 15 seconds. And then I will give it time to dry. So I'm going to go ahead and take the cap of my needle off. And then I will be doing the Z-track method. I'm going to go ahead and lift him up to my working height. Okay, so I'll be doing the Z-track method. We'll take the end of the back of my hand, and I will be moving his skin back 1 to 1.5 inches. Okay, you're gonna feel a little bit of a pinch. Okay, 1, 2, 3, and then I'll be administering within 10 seconds. 7, 8, 9, 10, and then I will hold for 10 seconds. 9, 10. Okay, I will release this. And this is when I would use any gauze to just kind of like help with any bleeding. I put my safety on, but I would not massage the area. All right, and I'll make it comfortable again. Okay, so now I document that I would have given this at 8 a.m. I would document that was the right upper arm, and that was 1 milliliter, and I would initial. Okay, so now I'm going to verify that my last medication is the varicella vaccine. So this is 0.5 milliliters. I've drawn up 0.5 milliliters. All right. And then this is varicella with an expiration date. I will be giving this at 8 a.m. This is Jamie Wheeler, birth date 10/31/1947. I'll be giving varicella 0.5 milliliters subcutaneously, 10/31/1947, Jamie Wheeler. Okay, so now I'm going to go ahead and just once again teach my patient why I will be giving this to them. Okay, Mr. Wheeler, so today this will be your last injection medication. So I'm gonna be giving you varicella. So this is a vaccine. This is gonna help you develop some antibodies to the varicella virus, also known as the chickenpox. And this will just help you become immune to this disease. Reasons I wouldn't give you this medication would be if you're on any immunosuppressants, but we know that you aren't on any of those, so we'll go ahead and administer this medication. Some of the side effects you might feel, you might have some fever, pain at your injection site, and if you were on any immunosuppressants, it would decrease the antibody response to your injection, and you could get this disease. But luckily, we're going to give you this medication today, so that will not happen. So once again, I'm just going to ask you if you have any allergies. Okay, so he has stated again that he has an allergy to codeine. So I'm going to give this medication subcutaneously. So this will be on his right lower abdomen. And so he has not had any surgeries or any other injections there, so it's okay to give this injection in his abdomen. So I'm going to go ahead and prepare my site. Provide privacy. Do this for 15 seconds. Alright. So since it's subcutaneously, I'll go at a 45 to 90 degree angle. I'll pinch the fat. You'll feel a pinch. Okay, ready? 1, 2, 3. Okay. 1, 2, 3.
This is a 25 gauge needle, which is appropriate
10.
for
Okay, hold for 10 seconds. 1, 2, 3, 5, 6, 7, 8. Okay, then I would take this out. And then I'll put this in the sharps container, and this is when I would use gauze just to help with any bleeding, maybe a Band-Aid, but I would not massage the area. So at this point, I would be done with my medications, and I would go ahead and I would document that I just gave varicella at 8 a.m. initial, and where I put it at the right upper arm, or abdomen, sorry. I gave it at the right abdomen, and then I would initial and sign that this is what I have done and it was correct with the provider's order. And so at this point, I'd make sure that my patient was comfortable, and I'd keep assessing them for any side effects or adverse reactions, and then I would lower them to the ground, like lowest comfortable position, make sure the bed rails are up, make sure their call light isn't near them,
Finally, I'm going to be
and yeah, I just keep evaluating.